if that's okay with everybody. There we go.
Do we want to wait a minute or two to see if anybody else jumps in? Or do you think we might? I think we might have a small group today, and I don't know that we got a Gov delivery out about it. So it might
No,
just
we
be a couple.
definitely did get one out. I was very
Oh,
smart about
good.
it.
Mm,
But yeah, it might just
yeah,
be a
you
small
were. You're
group.
like, you
That's totally
take that back,
fine.
Jackie.
hmm if more people pop in, that's totally fine too. But this might be a good discussion for a smaller group anyway. And we're gonna keep having discussions like these. So we can go ahead and get
Oh, there's
started.
more folks in here than I thought. Never mind. I take it all back. Okay. Well, you'll all be pleased to know. Are you ready to get started, Nessa?
Yes.
That's okay,
Good.
cool. Sorry,
Yep.
I realize I'm just charging ahead and talking. One of my favorite things to do. Um, You'll be pleased to know we don't have a big old PowerPoint or anything for you all today. Not that those aren't very exciting. And you'll also notice that it's me and Anessa here and not Nikki with AHP. I know we're getting used to seeing Nikki in here. Anessa and I kind of wanted to give you just a few updates about this call in perpetuity and sort of mostly take this time with you all as our captive audience to give us some feedback about what would be useful on this call moving forward, because I know we get together for lots of different reasons, and sometimes maybe the clarity between the reasons we're coming together can get a little confusing. So we can demystify any of that, figure out what we're wanting out of
Yeah.
this call, specifically the Fidelity Reviewer community call. And then also, since we have you trapped with us anyway, to know a little bit more about what you all are hoping for the future of FCS Fidelity. I'm just going to do a blanket. We don't have incentive funds. So I will dog ear that as something we probably all want. But mostly to give a little context, what our FCS team is looking at. And I know we did a previous call, and I don't know that everybody here was able to make that one, sort of explaining what Fidelity has been in the past, where we are right now, where we think we might be headed. And we just wanted to get some feedback from you all about what you see as the future of Fidelity reviews. So that's what we were thinking. So if we don't take the full time, that's just fine. Or if you're not in a place where you can give feedback now, like if you're driving or would rather use the chat or something like that, you can put answers in the chat. You could just chat with us as we sort of move through some questions. Or you could always stew on it and email. Looks like Dre's already coming in hot in the chat. Make them mandatory.
Yeah, for real. That's good feedback. That is important that that's a we've gotten that before already. So yes, that is a note and we love it. And that's the plan. And we just don't know exactly what that's gonna look like yet because moving forward, they're gonna be part of the WellPoint contracts, but we need to develop all the language and specific points around that.
Yep. So let's do a little story time really quick, and I'll sort of do a too long didn't read on the past, present, and future of Fidelity so far. Oh, and Kira, thank you for chiming in the chat. If you want to drop your name and who you're with in the chat, or tell us, that's great. That way we know. Um, so I
Yes,
can
that's a
kind
good
of
idea.
explain that a little bit just to give you some context before we ask you for your insight. And it's long story short, when the program first launched, Fidelity reviews weren't just for IPS or PSH, whether you're doing housing or employment or both. Uh, they weren't just optional, they were incentivized. So the HCA would contract with organizations to host Fidelity reviews. And the reasoning for that was because when there's a new program where the nature of the evidence-based practice you're trying to use is based in individualized service and is touting that the best engagement comes from voluntary uh, and autonomous participation in services, then it felt a little ironic to make that mandatory. So, because there was funding there to incentivize new providers, not only to join the program as providers, but also to sort of build new programs on those evidence-based practices in a more voluntary way. That's where it started. Where we are currently is we have unfortunately run out of those funds, so we can no longer incentivize Fidelity reviews or reviewers. However, they are not yet made mandatory through any contracting with WellPoint for providers. So we're in this space where we can absolutely still do Fidelity reviews. We're hoping that a lot of you are still inviting Anessa and I out to do that, or Dawn and Darren on the IPS side to come hang out with you and provide support in your programs for employment or housing. And also, we understand that it's a burden and that to host, even as fun as we are, that it's a lot of work. that goes into that. And then where we're headed next is we are looking at an eventuality within the program where fidelity reviews are likely to be made mandatory through um, WellPoint contracts. Um, there are such things as necessary burdens. Thank you, Mike. And cute burdens. Look at me and Anessa and Don and Darren. We're the cutest little burdens you ever saw. Um, but so where we're headed is that they will likely become mandatory in contracts with WellPoint. And you might notice Kira was just chiming in the chat that there are a lot of providers. We have coming up on oh yeah, Mary Beth. So a fidelity review, for those who aren't familiar, would be where somebody who's an expert in either the principles of permanent supportive housing or IPS, individual placement services for housing or employment. In the past, that's been myself and Anessa for housing and Dawn and Darren for employment, but we've also trained a lot of people on what it might be like to be a lead reviewer, to go forth and do something like that with our support, but maybe not our physical presence. And that's part of what we want to get your feedback on. We come out and we look at programs. So we do a desk review of a bunch of agency documents like policy and procedure, employee handbooks, training materials, outreach, all sorts of stuff like that about your FCS employment or housing program. Oh, Mary Beth, we hate when people call it audits, but yes, it's like an audit, but it's a programmatic audit, so it's not like a Medicaid audit. We're not looking at like authorized billings or anything like that. We're basically looking for the degree to which your program is in alignment with the best practices that the programs are built on. So it's low stakes in terms of you never get in trouble because of our fidelity reviews. You just get a report that kind of outlines ways that you could maybe improve the program. Yes, no pitchforks or torches, unless that's how you like us to show up. We can do whatever you want. But so yes, we're moving toward those things being mandatory. Like I was starting to say, we have coming up on 200 FCS providers across the state and over 500 sites where services are offered. And Anessa and Don and Darren and I are real cool and unfortunately have not found a way to clone ourselves and be in more than one place at a time. So as you can imagine, once fidelity reviews become a mandatory part of contracts, uh, the question becomes the whole purpose of that is a quality assurance measure, right? And so, what would a sample size be that utilizes a mandatory fidelity review to really ensure in a genuine way quality of programming or services, right? And then in what way can we increase our reach to meet that number of reviews in a reasonable way? Whether it's through a lottery system where maybe a review comes up like once every couple of years for an agency, then, but even at that rate, how many would have to happen in a year for an org to come up even once every 5 years? You can crunch the numbers and do the math based on how many providers and sites I just told you we have, right? So with that context, Anessa, what I mean, chime in also. What we were hoping for input from you all is just sort of where you see things going, how you see things, if it were to become mandatory in a WellPoint contract, sort of how you see fidelity reviews still being engaging in a voluntary way enough to incorporate that continuous improvement, and also how you see the provider network, yourselves or us, sort of mitigating that in the future. Because we have lots of thoughts that we can take back to our supervisors, but you, at the end of the day, you're the houses we're crashing, you know. I see Mike with a hand up.
Yeah, this may not be super popular, but like if we're gonna have mandatory, which by the way, I'm all for making it mandatory because like, an audit, a traditional audit is really important for the agency, but a fidelity review is just as important for our clients. And like, that's why we're all here. And so I'm all for it being mandatory. I'm just wondering if we're going to change that language, then why do we push back on the comparison to an audit? Because it is an audit for our clients, and like if it's mandatory, and I think that's good. I think that sets the tone of it being a really serious part of the process. And while it may not be, a natural transition to continuous improvement for a lot of agencies, it's a necessary one. And I think the idea of shying away from the comparison of it being compared to an audit was initially there because it wasn't mandatory, right? So we were trying to encourage, organizations to sign up and take it on. I don't think that mental model change would be a bad idea. I mean, if we're moving into that territory, which I think we should. Thanks.
Yeah. That's great feedback, Mike. What I captured in my notes is that when it becomes mandatory, just think about calling it an audit and leaning into that instead of shying away from that language for the reasons you kind of explained. Um, does that sound right?
Yeah, yeah. I mean, there's some nuance to it, but yeah, absolutely. I mean, you get it.
Yeah.
And I
Yes.
think
That's
we
great.
can do that while continuing to use the language around this is about quality improvement and making sure that we're serving the clients as best as possible. And we want people to come into it with the mindset of, I want to learn and improve and grow. And
Yeah,
yeah, and maybe we
Yeah.
could use more direct language around what it is too.
yeah. And it's a serious thing, but it doesn't have to be like a scary thing, right?
Right.
Yeah.
Yeah. No, that's yeah, well noted. And I grabbed that in the notes. I saw Dre's hand up first, but Dawn, was your comment specifically around what Mike was saying?
It was indeed. I
Okay,
looked
why
at
don't
the
we do that real
definition of an
quick?
audit just for fun. Independent examination of financial information of any entity, whether profit-oriented or not, irrespective of its size or legal form. So audit relates to financial, which is not what a Fidelity review is.
I
So
completely stand corrected.
yeah, no, but I like the fact that you're bringing up that maybe the terminology needs to change to have a greater focus on the importance. I love that. But I knew there was something about audit that when we'd gone through the IPS training that it was like, we don't call it audits.
Okay.
So
Oh, Dawn,
that was
thanks for
evidently
catching
it.
that. So I edited our notes now to say that maybe we can make sure to delineate between the difference between an audit, which would be financial, and maybe call it something that still carries weight, like a quality assurance review, programmatic quality assurance review, or something like that, that kind of reflects the weight with still drawing the line between the financial piece. Dre, what up?
Hi there. So yeah, I'm in complete agreement with Mike here. And I understand audit is more focused on financial aspects, but I mean this is a program where there is financial benefit, and I that's that's not lost on Pioneer, but it's also not the motive.
Mhm.
And I think whatever that terminology looks like. I like the terminology audit personally because like I know it feels punitive, but there are times when a punitive stance needs to be taken. And I think more direct terminology might increase the integrity of providers within the scope of SCS. And I think that's necessary. Maybe it might encourage more intentional services, more fidelity based services, and obviously that's going to impact outcomes because fidelity is it's an evidence-based practice. So I mean at some point this isn't going to be a waiver, this is going to be an entitlement, and so audits are going to be relevant.
Yeah. Dre, I'm ready to follow you into battle. When do we go?
We've Pioneer's been in this battle for a while.
Great. I captured that as well. And this is really helpful feedback. I know that Anything Helps and Pioneer are both really committed to fidelity in their own programming. And I'm not surprised at all to hear you sort of ready to take that on, and whether it's mandatory or anything, because you've been taking it on anyhow organizationally. But it is really helpful feedback. I think we've shied away at the Healthcare Authority, especially in a newer program, from sort of thinking, oh, we want things to be accessible. We don't want people to not provide services because they're nervous about how it's going to go, or they're a nonprofit that wouldn't usually be in the Medicaid space, but they're new to it. We don't want them to feel discouraged, things like that. So it's really helpful to know that maybe that's not how everyone's feeling in terms of a quality assurance review, and maybe what we were kind of thinking would be a sensitivity is maybe not a sensitivity for everybody. So that's great. Here, I see you've got a hand up as well.
Thank you. And I just want to echo just kind of what everybody has said so far. I too am in support of them being part of the contract. One of the things I wanted to say is that there is a service provider, an FCS service provider just right down around the corner from us, who is at risk of having in fact, they have a cease and desist order on the 21st because they provide services in the downtown Everett area from a first floor building. Now, having these audits that show that they're providing evidence-based services to our community would be beneficial to show the community leaders, the work that they are doing works, that have the supported outcomes because of the evidence-based practices.
Breaks my heart that they're in a situation like that.
Absolutely.
I'm not surprised. I'm just sad. You know what I mean?
Yeah.
And that's a really good point, Kira. So I'm capturing that maybe another benefit to having a report or sort of an audit result. It demonstrates how great services are going and why they're so necessary when they're trying to self-advocate to city officials or people who are giving them trouble. Got it. That's all very helpful feedback. Is there anyone I know this is a little high pressure given where the conversation's gone. Is there anyone who feels differently where they think to themselves, oh gosh, the fact like this becoming mandatory has me shaking in my boots. Like the thought of having to do that even once every 5 years would be a significant impact to our organization. And like, despite loving continuous improvement, maybe this would be a big barrier. Anybody who would be in that camp or have that experience?
Maybe I was wrong. Maybe it wouldn't have. Maybe it was not.
Yeah. Jay, I see you've got a hand up.
I'm not going to say that we shouldn't make it mandatory. I agree with mandatory. I think that words have a lot of weight, and using the wrong word can create a response in the fidelity reporting itself that concerns me. When people are in an audit, they're trying to show a picture of an organization and a picture of a situation. And sometimes that can be problematic, and it's digging into things, and it's creating an environment where people want to be forthright would be good. And so how do you, a different word than audit, evaluation. An evaluation can be a self-evaluation that you have to recognize there's a negative and a positive to, and the full face of both, versus an audit, which is a direct attack on somebody's verbal response or written response to their surroundings and being audited because the situation may be wrong. So could we use a different word than audit?
Yes, Jay, that's really helpful. And I appreciate you weighing in. And I think exactly what you're saying is what has been sort of some heartburn we've had on the team in the past around what drives like a true commitment to really wanting the feedback to grow and doesn't make people feel like they need to do something performative or hide their mistakes, that kind of stuff. Because all of the great feedback comes from the mistakes. So I think that's really valuable, and I appreciate you saying that. And we can totally be mindful. You also said something else that I want to come back to. So just group accountability, don't let me forget. You said self-evaluation, and something that my brain had wondered a few times is maybe in the future of fidelity reviews when we're trying to keep the number of them manageable, but still keep people focused on quality assurance in the years where they're not having a review with their own organization. How might we utilize a self-evaluation or a peer-based evaluation and not a formal HCA, DBHR trainer evaluation? So we can come back to, I just want to float that because Dawn, I see you and Mike both have hands up, and I'm guessing maybe it's coming back to what Jay was saying.
Yeah, I just wanted to say really quickly, I don't remember who had said the language issue was a problem. I don't see their name in here. But sorry, I know that was just a second ago. But one of the things that I think is really valuable from fidelity reviews is the fact that we're able to kind of take parts away from, other programs that are really valuable. And that really comes from the equal power dynamic that occurs from really framing the review in a way that is peer-based. I'm here to learn from you as much as you are from me. Like, I'm here to take away things back to my agency. And I do agree that going in as, another agency, that can, with a serious tone and judgment. It was Jay. Thanks, Jay. I'm glad you said something. Uh, I worry about, I do worry about the outcomes not being as beneficial for the other agency in that respect. So, I mean, it's just something I think I'm just echoing that words are important. Still think it should be mandatory though.
Thanks, Mike. Don, you have something you want to chip in?
Yeah, well, just and I know some of you know about IPS fidelity reviews and some know more about housing. The IPS Employment Center has been talking in recent meetings because they have trainer meetings with us periodically about the idea of doing some things like self-reviews. One of the principles in the IPS fidelity scale is that agencies are encouraged to take the scale and do a self-review periodically. It doesn't count for, adding a score to the system or whatever, but it counts for kind of knowing where you're at and being able to prepare and do some of your own quality improvement, kind of without getting that fidelity review, but indicating that that could be part of the process between reviews. And they've also come up with what used to be always face-to-face, they can now do a hybrid. So one day face-to-face, one day not, is one alternative. And then another alternative is they've come up with a quality assurance review that doesn't give scores, it just gives recommendations and is a little less work for the agency. So trying to come up with alternatives that fit all the different scenarios that there might be. And I just wanted to share that information because it's something that's been addressed by at least the IPS Employment Center as well.
I love that, Don. And there's so much. I know this group is pulled together primarily because we're housing providers, and this is the PSH Fidelity Reviewer Community Call. And employment and housing are inextricably connected, and we can learn so much, even if you're an organization that at this time is only providing FCS supportive housing and you haven't taken a foray yet into FCS supported employment. We can always be learning bidirectionally from other evidence-based practices and letting the experience that Donna Darren have on their team and within IPS inform these things for us. And Donna, I appreciate you so much being here and sharing that, and sort of helping us have that reminder also, just always on our minds. Kira, I see a hand up.
Thanks. And Don, I'm so glad you're here because I mean I've talked to a few people that I'm committed, I believe at this point of starting the Snohomish County FCS coalition. And I'm thinking that the more counties that start to build strong coalitions around them, the more that the conversation is going to be had on a more of a regular basis with the providers in the area to like start changing what that language looks like, talking more as a group of what fidelity and why it's so important. And, knowing just like what Mike said, this is a peer review process and we want to see what you're doing that's so great. And this is the things that we do. And to just kind of normalize that quality control and quality assurance that, throughout each county is kind of, we're all following the same framework.
I love that, Kira. Actually, you put something in the chat earlier that I captured in my notes as well that so I'm hearing a couple different thoughts then maybe about sort of the future of what reviews could look like. One is maybe could there be the use of a coalition, either to advertise or to provide support or just build positivity around the purpose of a fidelity review, and sort of contribute to that overall, like the vibe. Um, and
You mean
also, I'm wondering if there's any way to use coalitions, like coming back to my earlier wondering about a self-evaluation or a peer evaluation. There could be a way to think about, well, maybe not everybody's number gets pulled super frequently for like a formal fidelity review, but everybody submits a self-evaluation or an evaluation of a peer agency in their community or in a totally different community that maybe could become connected in a buddy system through a coalition. Because self-evaluations are so helpful. And also sometimes it does help to have an outside perspective. Or maybe when you do, even if you do a self-evaluation, you pull in like your own review team of some folks from other organizations just to help you weigh in or something like that. So I am kind of curious if anybody has any thoughts about that. And then, Kara, I also saw you say earlier in the chat that maybe a piece of it is thinking about how new an organization is to providing services. And maybe that could be factored into a lottery system about when somebody would be reviewed as a baseline. Maybe if it's toward the beginning of their contract period, just while they're still early in services and have the chance to really build a program around Fidelity.
Well,
Is
and
that kind of what you
especially
meant by
so that,
that?
yeah, so and especially so that they don't just start building bad habits right out of the gate. It's like just get that
Yes.
corrected early on. Because I've said before, people don't do the wrong thing over and over again on purpose. When we know better, we do better. So,
Yes.
Yeah, I love that. When we know better, we do better. Absolutely.
And I think we can like divide, like the power dynamic issue, like, and ensuring that there's this, more pure, focused dynamic. Like I think you can divide out the bad guy and the enforcer and just put the blame, for the enforcement on the healthcare authority. Call them the bad guys, right? Call them the ones that are requiring it, the big brother, and then if you keep it peer reviewed, then we can keep it wholesome and like engaging on our end. But we're all working in tandem, right? Like we're just distributing the scary portion.
well, Mike,
Yeah.
you're absolutely right. And just look how much weight peer-reviewed journals are in the scientific world. Look
Yeah.
how
Oh,
much weight those
yeah.
hold, right? Yeah.
Yep. And we can just be like, oh, these crazy healthcare authority guys are making us do this. We might as well get something out of it. Like let's make the most of this. And like,
My gosh.
it's easy. It's easy.
I also love this alter ego Anessa and Dawn and Darren and I just developed. This is
I'm happy
very
to be the
good.
bad guy if that makes things
Absolutely.
easier for everybody else.
I'm gonna write her backstory. I'll get it out to you guys for review. Uh, and I'm having another thought. So just to give another little piece of context, right now we have sort of these three different training levels, and to like way oversimplify, at least on the permanent supportive housing side, like FCS Fidelity 101 would be considered like these are the principles of permanent supportive housing and the components of the evidence-based practice that we know produce the best, most positive long-term outcome, right? So that's like, these are what the principles are. This is how they might look in service. The 201 level would be our PSH Fidelity Reviewer training. So that's sort of like, okay, this is a deeper dive into the principles and how they might look if you were to be a reviewer at someone's agency. So, or if you were to host one, right? But if you were to be a reviewer at someone's agency and you would be doing a desk review or you would be doing a participant file review, how do we see these principles operationalized as actionable items in programming, right? And then the 301 level that we've trained on so far would be our lead fidelity reviewers training. And that's taking it one step further, where it's like now you are a subject matter expert in the principles of permanent supportive housing. You have maybe attended or hosted a few reviews, or you've been a reviewer a couple times. And now, what would it be like for you to be the lead at a peer review? So if you go out and do a peer review where you could always obviously connect or consult with Ines or myself, but you would be the on-site go-to subject matter expert or leader of a fidelity review. This is what you would need to know to facilitate that process. This is what you would need to know and feel confident answering if your review team had questions or you were unsure and there were gray areas, you would be the level of subject matter expert to be able to answer those questions. So we have people trained on all of those things throughout the whole provider network so far. And the thought for a long time was maybe we could use those lead reviewers as a cadre of folks who would be considered qualified to go out and lead reviews in a similar way to Anessa and myself. And that's also a big ask and a lot of responsibility. And we don't know to what degree we'll be interested or able to utilize that exact role in the future. But do you all have any thoughts about those trainings or what other trainings or level of sort of commitment we could have within that, or how that might play into self-evaluation or peer evaluation, even if it's considered less formal in some way than Anessa or myself coming in? Any thoughts on that? Michelle?
So we talked a little bit about this in our coalition meeting, I think last week. And I think that what I said was like, this has to start at the top level, right? This has to start with management actually making time for trainings and actually requiring those trainings. Like I know I just have several people who work for different agencies here in Spokane, and Some people, say, well, I was supposed to go to this training, but I couldn't make time for it, or I couldn't go to it. And so, like, some of them have never even experienced the initial Fidelity kind of trainings. And so, if you have never taken a Fidelity training, how can you do Fidelity aligned work? Like, if you don't know, if you only have the bare minimum tools to do your job, then you're only going to be doing the bare minimum job, right? Um, and and it's not just a disservice to the people that we serve, but it's a disservice to um, the person doing the service, right? Because none of us get into this work because we are all like, well, I'm just going to go do this work and see how many lives I can screw up, right? Or only help half-ass, right? Sorry, excuse my language. But like, none of us get into this going, well, I'm just going to do the bare minimum and hopefully not screw anything up too badly. So I think that we all have the intention to do great work. I don't think that we always have the support, and I'm not speaking from my job because we go to all the trainings, but
And it
and
sounds like that's made a difference,
and
though.
that's required, right? And that's why we, I think that we do well at what we do. But I think that if management or supervisors don't have the tools, if they're not going to the trainings, right? And then they're not passing that down to their people, or they're not requiring those trainings, then we're just doing the best we can with what we have, right? And so that, I think, is kind of a priority, is making sure that that the supervisors and management know that this stuff is required for people to do adequate services for the people that we serve, because it is about them.
Yeah, Michelle, I love that. And I would even push what you said one step further and say we work in a really high intensity, high burnout, high turnover field because of exactly what you're saying. Because people show up with the intention to do good work. And if you don't have the tools, it just eats you alive really fast. I've been in positions where I felt immediately like 2 months into a job, I was like, everything's terrible and nothing will ever be okay. And I don't know what I'm doing. And I'm responsible for some really high stakes things.
Right. And I know Mike has something to say, but just with that, Jack, we have to celebrate successes. Like, we have to succeed at something, whether it be, small or big things, right? Our people have to succeed, and that helps us succeed. And if that's not possible, then people will give up on us, and we'll give up on our jobs.
Oh my gosh. Michelle, you and Dre, I like Braveheart feelings. Wherever you go, I go. This is great. Mike, what you got?
God, at first Michelle, oh my God, that was amazing.
Right?
Well put. Well put. I was just going to say, like, I just want to use an example of what the Houston Continuum of Care did with their contracts is about a year and a half ago. They required all of their contract renewals to agree to regular convenings of the entire system. And that was part of their contract requirements, right? So it became mandatory to collaborate. And it was mandatory to attend these meetings, play a role in the continuum. And what they saw was a mass improvement in their homeless response, significant reductions in homelessness. And then they took it out of their contracts this year. And the convenience continue to happen, right? They're still happening. They don't want to go back. There's no way that they would ever go back. Like, what they did was they jump started a more collaborative instead of competitive atmosphere. During their NOFO that year, they all decided, some organizations gave their money up that they were awarded to send to other agencies that were going to have more of an impact, because they knew that it would, right? And so you started to see a lot of restructuring and reorganizing, and and just a much more effective response system because they established this mandatory cadence of collaboration. And I see the same thing with Fidelity that could occur with this mandatory expectation, is that you're just getting people into the door of Fidelity and you're ensuring that they are required to go along for the ride and see the benefits and ensure that they understand, what this is all about. And, if you keep that outcome in mind, that's possible, I feel like, it won't be a necessary evil anymore, because people will see the value in it. Yeah.
I love that, Mike. I totally captured that. A big focus for us this year in FCS in general is sort of partnership and collaboration and working to shift competition to collaboration. And that's a constant conversation we've got going on. And so I'm going to do a lot of looking into what you were mentioning in Houston and seeing maybe there's a way we can get some of that data reported at the FCS symposium later this year or something like that. That would be really cool. And then, Michelle, something I grabbed to go back to what you were saying also is the thought of sort of how training in alignment with like a fidelity review, a mandatory fidelity review, maybe some mandatory trainings or ongoing trainings for new providers or for continuing providers to make sure that those things are happening at the same time. So that we're not asking people to do something that they haven't been taught how to do. Here, I see you've got a hand up.
Thanks. Yeah, I'm like, I've got goosebumps like from this meeting, just from what everybody's sharing. And Mike, I thank you for sharing that story. When I went to the open house yesterday for the place that is at risk of having to lose their services where they're at, I was telling them about the coalition that I wanted to start, and they're very interested. They want to help too. um about my whole focus this year has just been about collaboration and getting the providers to talk more and share resources. And she goes, share resources, kind of sarcastically, right? Because nobody wants to share any resource. Everybody holds them so tight to the vest. I'm like, there are plenty of resources for everybody, and there are plenty of clients for everybody. And that is the whole thing, that we have got to collaborate together, because I don't have all the answers and you don't have all the answers, but together we can do this, And so I love that idea, Mike, that they did there. And just and again, the training from the get-go, I've told my story before. I didn't even hear the word fidelity until I was running my program for almost a year. And I just like shudder at the thought, if I had not learned about this, right? And I revamped my entire training schedule. I mean, I just redid the entire program to fall more in line, and we're still working on it. We're still growing. We're still, learning new things and making adjustments here and there, and we're not always in line with Fidelity, because it's impossible to be 100% in line with Fidelity, but we're working on it. So yeah, I just appreciate it.
I love that. I was also having a thought, just this is for you and me and Donna and Nessa and Darren. Maybe something we can think about is we have so many trainings that we do all the time, so many trainings that we could develop that don't exist or utilize our national technical assistance to make happen. I wonder if maybe we, like, if we were to think about some mandatory training as a part of also mandatory fidelity reviews, if we could make like a training menu, like almost like a little guidebook that we could give to new agencies. Like, here's what you have to go through as you launch. You need to take at least these things. And then down the road, as you want to deepen your understanding, here's all these other things that might be available, like a really easy, like, here you have it. That might be a fun idea.
Yeah, I like that.
Michelle, I see a hand up. And Dawn. Maybe Michelle first and then Dawn.
Sure. I was just going to say, we talked about that in the coalition meeting, I think last week or whatever it was. My time just goes together, but
I feel that.
We talked about, like, not everybody's learning style is the same. So like, sometimes Zoom meetings don't work for me, because I would I'm sitting at my computer, so that means that I should be doing like work, right? And so sometimes I'm not paying attention all the time to what's happening in the Zoom meeting. And I know that when we talked about it at the coalition meeting, that was a probably a similar statement amongst all of the people there, right? So maybe some more in-person trainings to where we actually have like in-person exchange. I keep hoping that, COVID is over, so we'll start actually meeting in groups and meeting people, right? That's how we create community connections, is by knowing who works at other agencies. And I heard somebody say earlier, like, that they were just referring people to another agency because they got more, they would better serve that person. I am 100% in line with that, right? Nobody is a shortage of people right now. I mean, granted, we have the wait list, but we're moving through it. But if we can't provide a service for that person, our team is like that, right? If we know some other agency can provide a better service based on like their barriers or their age or their whatever, then we're willing to refer those people out to somebody else, right? Because they have the resources, they have maybe more tools or something that is aligned specifically for that individual. And sharing is hard to do because people want grant money. They need grant money to survive. They need money to make their company work. So I do also believe that we should stop siloing our nonprofits based on dollars. And sometimes data doesn't always prove who should or should not get the money.
Yeah, that's a great point, Michelle. Dawn, got your hand up.
Yeah. So Michelle is the coalition she's talking about is the one in Spokane. And I'm hoping Michelle will weigh into what I've seen is a lot more collaboration, a lot more of an agency that has expertise teaching another how to do whatever it might be. I know that staff from Pierre Spokane ended up teaching staff from Triumph how to really work with Fidelity because it was such a hard thing for them to do. And so that's just one example of the things that are happening. So, and I love all the conversation I'm hearing about coalitions and, quality of service and trainings, and perhaps we can work the idea of a coalition into contracts. I don't know. With the idea being that our coalition, we end up doing each time pretty much a training that's of benefit to the whole group. We've got one coming up on why community time. Why should you be doing community time? Because some folks struggle with that. Where can you do community time? What does it look like? How is it documented? Whatever. So that's coming up in our coalition for November. And some of those trainings that, like Michelle said, I think face-to-face is truly beneficial. We tend not to multitask if the trainer is standing and looking at you.
I was literally emailing Mike a response while Michelle was saying that. I was like, oh, shoot.
Yeah, no,
Getting called
absolutely.
out.
Face-to-face trainings are better for just a lot of reasons. You can read body language. You can tell if somebody's not getting what you're saying, which you can't do in a virtual training. So,
Yep.
Perhaps working in some fashion coalitions in that face-to-face training could be a piece of what we're doing as well.
Yeah, Dawn, I love that. And Dawn and Anessa, I was having a very similar thought, and it feels kind of like what you and me and what we were talking about with Darren yesterday when we had our meeting
Mhm,
about like, is there a way to do some quarterly in-person get together
mhm,
that's like part training, part like networking mixer situation where providers could come out and hang out and get that network face-to-face time with each other, come for like a formalized reason, like a training. And then just figuring out the best way to do that to bring value, whether it's geographically or like by topic or like what it is, it's really going to bring people out to do
mhm,
that.
mhm.
But
Absolutely.
Michelle and Dawn, I'm hearing you, and I tend to agree that like the face-to-face time is different.
Yeah.
Than a Zoom meeting, and just thinking about how we can like if we're thinking about making fidelity reviews mandatory, how we almost make some of these supports mandatory. It sounds kind of like what Mike was talking about the city of talking about Houston doing,
Yep.
where it's like you make something mandatory, like a coalition, but then the value sort of outweighs the mandatory component over time when people start seeing how it's useful. So maybe we do like a quarterly in-person thing. And if it just happens to kick off a grassroots local coalition that wants to meet monthly, whether or not we're there in person monthly, also, you know what I mean?
Right.
These are
There you
such
have
good
it.
ideas. I'm so glad that we're having this conversation.
I know. Goosebumps for me too, Kira. I know you said that earlier. We do, so I want to, another thing that we actually want to touch base on super quick, just since I told you we might not take the whole time, and then here we are. Whoops, can, I always underestimate time. Duly noted. But is sort of the purpose of these meetings ongoing. This was super helpful for us, and I really appreciate all of your insight. First of all, the work you do in general, and just your thoughts. It's so helpful to us to know what you're thinking, because then we can take this back internally, Don and Darren and Anessa and I, and also back to our supervisor and back to our team at WellPoint and kind of let them know what you're thinking. So the more, this isn't the end of this conversation, this is like the start of this conversation. So if you have more thoughts, if you're a steward like me and you want to email it later, if maybe we post this recording and you didn't attend but you want to weigh in, you could email Anessa or myself or Don or Darren to share thoughts if you have more that come up. But we want to think about this meeting ongoing too. So what we did when we started these meetings last year was we had Nikki from Advocates for Human Potential come in and sort of focus on like one principle a month and talk about this is what this principle is, do a deep dive into that principle of permanent supportive housing, talk about how it looks in a review, like what we would be looking for in a desk review or a participant file review, or in interviews or services, if we were to be a fidelity reviewer, how we would see that principle in action and in documentation. And then in sort of the off months where, because obviously there are only 7 principles, in the additional months, she was kind of talking about these are common things that come up, like how to make a good survey, how to make a great intake form that's, or you know, how to focus on a good policy procedure. So we are no longer going to have AHP do these calls. Their body of work as our national technical assistance is going to shift a little bit for at least this year because we have lots of projects we need them in on, and we have a whole internal training team, which is ourselves. So Anessa and I are going to be facilitating these calls. Do you have any thoughts about maybe we could do a lather, rinse, repeat, and continued focusing on a deep dive of principles and sort of filling those off months? We can make this more conversational or an opportunity for provider feedback from a fidelity focus specifically, like here's how we see fidelity looking in the future, here's how we want to weigh in on trainings. What would you like to see coming out of these calls? If they're continued monthly, if they should be every other month, what do you want to see?
Yeah, it would be great to just kind of get like a brief update from the people that attend on what their organization is up to, what they're doing, and uh, what programs might be available that we could refer back and forth to. I don't know if this is the right space for that, but I'm always curious every time I jump in here. So
Totally. So that could be kind of a standing agenda item, just like program updates and introductions or something like that. Yeah, helpful. Okay,
And then maybe and maybe take just one section and do a deep dive, and then any other kind of input and feedback around just kind of the forward movement of momentum of fidelity and what that just looks like as we're rolling into the next year.
Okay, so maybe kind of a standing agenda item to do updates on Fidelity Future.
And a definitely some kind of a training component.
Yes,
Whether that's
absolutely.
yeah, maybe Anessa, we could think about sending out an agenda like a week ahead.
And
Or
having
if we just
folks,
decide months. Yeah, because I'm almost wondering if we can use it kind of like consultation with one another hours too, where it's like if we know this time
yeah.
we're talking about the dimension of choice. Maybe people want to actually bring like this is the intake we're using, and I feel like I want to show this team and get feedback on my form, or this is the policy procedure we have, but it doesn't feel right, or we think this is amazing and we want to share this out. Would something like that be useful?
And I think if we know ahead of time, then we can also gather questions from like my case manage my team members, like things that they're wondering about that maybe I'm not 100% sure about, and bring it back for everybody to kind of chew on and see what the consensus is.
Yeah, because Anessa and I could, I mean, if we're planning to literally sit down and plan out the entire year of like, this is what you can expect in January, February, March, April, like ongoing, so you would know that far ahead. Um, to be able to bring questions or to bring the materials you want to share, you want to get feedback on, that kind of stuff too. Does that feel useful? Okay. Shoot, that's time, you guys. Don't we book this for an hour?
We've got 30 more minutes. I think it was set to go
Oh,
until
shoot.
2:30, so we totally have time to keep chatting.
And there's a good recommendation from Dre in the chat
Oh, I
that
didn't see
would
it.
elevate.
Oh my gosh, I've missed so much in the chat. Katie likes mandatory
Okay, I've been
reviews,
keeping up.
starting a laundry to get started. Oh, good. Anessa, you captured all that?
Yeah.
Oh, beautiful. Thank you. Dre thinks it's a good space to discuss how to ensure the sustainability of FCS, including barriers, resources, and how we can support each other with alignment with Fidelity. Yes.
Totally.
My favorite thing about that, Dre, oh, Kira, thanks so much. We'll catch you at the next one. Thanks for joining us. What I love, especially about what you said, Dre, is the peer feedback component. I don't think you'll be surprised to hear that, like, within our FCS team, any peer perspective should be the center of focus, whether that's hiring peers into your programs to support participants, whether that's working with your FCS provider peers about what it's like to provide the program and those kinds of things. And so, if you feel like this is a good space to discuss the sustainability of ACS, what barriers you're bumping into, what resources are there, how you can all support each other, some of those coalition components. Thanks, Veronica.
I know one of the things that we did in the coalition that might be well served here is one of the early on meetings we discussed what's your niche as an agency? What are the things you do incredibly well? To foster that opportunity to reach out to others and say, I need help in this, and you guys are good at it. What are some resources I could access? That kind of thing. I know somebody mentioned that folks will try and hold resources close to their chest. Do, but one of the things I've really been impressed about with the coalition is that folks are very likely to share what resources they're aware of to help everybody else out.
I love that, Dawn.
So I think that in Spokane, we actually have done a really good job of sharing resources. We have a whole like Spokane Homeless Coalition group that actually thrives on providing resources and connecting people with their needs, which was not always this way. When I started in this field 14 years ago, it was really, everybody was all like, hush, hush, but it has gotten much better in our community as a whole, just being able to email this group and just get the resources sent, to an email. And it reaches like the far reaches. All of our outside counties are involved in it. And even some of like nursing staff, hospitals, all sorts of people who maybe just want to provide support, either financially or through some sort of item that is needed that isn't actually in the social service field. They just want to be, back in the background helping out with a need.
I love that. I know Spokane has some really incredible things going on. And I just, knowing what the coalition you all have going, I think there are different areas of the state that are more and less sort of open to that at this particular point in time. And I just think what you're accomplishing and what you're learning is so important to capture and report back out. So I almost wonder if this could also be sort of a space for like a statewide coalition and sharing and connection point that then maybe could start shifting some of those attitudes in different counties where maybe collaboration is still really, really struggling. Counties, regions, lots of different ways to sort of think about it. It's just really interesting, and Spokane's really killing it. Like,
Yeah,
I'm
we
really,
are.
ooh, talk about goosebumps. Ah, you guys are great.
It feels really good, doesn't it? It just goes to show how it can be. And I am so, and I've said to, I don't know, and Michelle, and if anybody else was on the from the Spokane Coalition on this call, I have bragged you up so many times, and Essa and I both have, for just the collaboration, cooperation, the positive attitude, that we're in it to improve the services to the people that are being served, and just that whole bag. How we got so lucky is to have the right group of folks in the right spot at the right time. I don't know, but it worked.
And it's a regional thing. Like, you'll see that collaboration versus competition, like culture, just like we're talking about Fidelity, continuous improvement culture, like, it's the same type of regional, like, polarity that you see. Like, it's almost like a duality, like you're either one or the other in terms of your region. And I think
Sorry. Yeah.
and I think one of the benefits of that mandatory practice is that you have the opportunity to drive culture change. So and I definitely know King County needs it so desperately. So
I've been in this, I'm a SEDP, but I also have done a lot of case management, and I've been in the field for about 15 years. And I did a lot of work in King County, Mike, and I knocked on every single community partner door that would let me in to introduce myself, to talk about what we were doing at the treatment center that I worked at, and looking to collaborate and make partnerships and stuff. And it was a difficult task. They were quite standoffish. And then in 2017, I worked back again in Snohomish County. And again, it's just been my mission to be knocking on everybody's doors and introducing myself. And this is what we do. I want to know what you do. In fact, my agency, every month, we have a different community partner come in and present about what they do, so that we can learn more about them. And they can learn about what we do, so that we're just building those relationships in our community. It's just so important. We just can't do this alone. I don't want to do that alone. What a burden. Good Lord.
And the nice thing is, in complex counties where there's maybe a more competitive like atmosphere around like pay points and funding and all those things that drive the feelings of competition, like when you have a tangled up knot of string or jewelry or something like that, you can jump in and start untangling that from a ton of different points. And my hope is that maybe by doing this type of work and starting somewhere, that this could be a place where we start untangling some of those things and getting to the heart of what we're hoping to see as a culture shift in some
like
of
that's
those areas. And
that's
why not
exactly
start
where
it here,
oh, sorry, go ahead,
Oh,
Carter.
I was just going to say, because what is the main point here is to provide the best services to our most vulnerable people in our communities, right? And we're all very, very passionate about that. We're going to step on each other's toes. It's going to happen, but just getting back to the basics. Why are we doing this? Why are we doing this?
Yep, I know. Mike and Michelle both have something to say too. Any
Michelle
order?
can go first.
I was just going to say, on this level, there was somebody back in the chat, and I don't know what it was, but it was kind of, I think she said, I think this is above my pay grade. And it was back a little bit, I can't find it now, but I think that's also the wording that we like need to resolve. Like, this is not above anybody's pay grade. Like, this is not just for supervisors or directors or HCA people. This is not just something that is for people who are above a pay grade or below a pay grade. It's for everybody. Like, and I think that some information is better received from people who may not have those big titles because they're actually boots on the ground, right? They're dealing with people, they're interacting with community partners, and I think that there is sometimes a separation between that. And I hope at some point in time that will stop happening. And people of all pay grades will go to these meetings or go to trainings or be involved because I think that the more voices that are heard, the better the change will be.
Michelle, what I'm grabbing from you saying that, I love you saying that. I am 1,000% in agreement. And maybe when we're thinking about the purpose of these meetings or making them accessible, we need to think about how we're advertising and who we're encouraging to come be a part of the conversation and what kinds of trainings or information we're including to be mindful of that. Does that sound right? Awesome. Mike, what you got?
I
Is
just
it done
want
now?
to, I want to let Michelle keep that mic drop. And what I was
It
going
was
to share
good.
was, what I was going to share was, it was part of the earlier discussion. It's not relevant as much anymore. It's okay.
Okay.
And hi, Kimberly.
We can come back to it too later if you want to. Don't save it or whatever you want to do. I, to pivot just a little bit, was wondering if maybe if Anessa and I kind of had an agenda planned out far enough in advance where you all know what to expect, like what principle we're going to talk about this month. Is there anybody within the provider network that would want to be the subject matter expert, sharing how their organization is doing a great job with those things, or to sort of be one of those presenters either alongside us or in place of us? Or like, would it be helpful if we had a way for people to communicate to us that they would want to do that?
Yeah.
I think that's a great idea, Jacqueline.
Yeah.
I'm seeing lots of yeses. That's awesome. Because again, the point is to share and connect um, across the provider network about Fidelity and what reviews might look like and how we can all support each other in the evidence-based practice, right? So is maybe the best thing for me to capture at this time how Anessa and I could make, like, could we make a little form to attach to the agenda, like where you could just say like, hey, I'd really love to jump in April, and it can kind of be first come, first serve. And we could just let you know like a confirmation if you're on deck
Okay.
or a backup or something like that. Is that a process that would capture what we want?
I'm cool with that.
And I say, are you cool?
Yes, I think that sounds great.
Awesome.
Hey,
And
I just wanted to mention I'm going to be meeting with one of our national TAs on how other states are doing Fidelity to kind of start the conversation for our future in our program. And so at some point, I think it would be cool to come share some of that too.
yeah,
That'd be
that's rad,
awesome.
Kimberly.
How versus what we've done and what other states are doing. With the mindset that we have a huge provider network compared to a lot of the other states that are doing similar work, but we also have to think about how we plan to scale Fidelity in the future. So that is a helpful conversation. I think it'd be good for you guys to all hear some of that.
Yeah,
Kimberly,
actually, we were talking about that earlier, Kimberly. Anybody in this group have questions that they want Kimberly to take to that meeting?
Kimberly, I'm curious what other states are rolling out programs like FCS.
Well, quite a few now. We have quite a few that are getting waivers, or we work a lot, really closely with Arizona. Um, they're doing some really cool stuff. California, Oregon, pretty much the West, a lot of the West Coast is doing similar programs, and there's quite a few in the East Coast too. I could actually get you guys a list of who is actually doing waiver type work like us. We were like one of three originally, so we were like the third state to jump into similar the waiver work like this. But yeah, it's happening kind of all over. New Jersey has a similar housing. They don't do employment, so some of them have different caveats to what they put in their waivers. But it's kind of across the country, more and more are popping up. Virginia is working on trying to get a waiver. So they're cropping up all over. But we were just kind of one of the first few to jump in and frontier this work. So, and we have one of the bigger provider networks that I've heard of. And we're working with 10 other states right now in an accelerator program where we're kind of learning from other states who are doing this, and they're learning from us, and getting some kind of national TA from like HUD and SAMHSA. So part of the conversation is sustainability and how we're doing things like quality improvement and things like that. So Fidelity's come up quite often. And so as we think about the future of FCS, what is going to look like to scale Fidelity to make it consistent across the board for our provider networks. So
we got a ton of really great feedback earlier in the meeting from this group about sort of their thoughts. There were some really good creative ideas about thinking about that. It was really exciting. And I want to put it out there again. Anybody have questions they want Kimberly to take to that meeting? Because we had a great, robust conversation about sort of like mandatory coalition meetings or some mandatory training alongside mandatory fidelity reviews or things like that. Anything you want to ask or her to ask other states or folks what's going on that they're doing that they've tried and didn't work, or they tried and didn't work, anything like that?
I have a like concern. So like when you share all of those new states that are kind of emulating waiver programs, like my number one thought is like, oh, that's terrifying, because the fidelity is such an important aspect of this work to demonstrate positive outcomes, and I worry that the more this this opportunity expands to other states, the more demonstrated poor outcomes can permeate into the federal side, and like that could put our program at risk. So I think it's just more important than ever to like stand up really positive outcomes for our program to ensure that it keeps a statewide standard of high quality.
That's our goal for sure, Mike, is that we want to keep it. We're mostly worried about Washington, obviously, but just hearing how others have had to implement. So for some context, Arizona had to, because of a lawsuit, had to start doing fidelity stuff, and they actually are required to post scores of fidelity reviews. And so for accountability purposes,
spicy, right?
But it's, if you think about it, if you were going to send someone to like a PSH building, right, would you want to know that they're providing good quality services, or would you want? So my thought is, how would you guys feel if we started? This is throwing this out there as a random question, but how would it feel for you to have your fidelity score posted, or something that says high fidelity, good fidelity, fair fidelity, and not actually put the score? Because we don't want people to focus on the score. So that's the other thing I think about, is like, the score is kind of it all over the place, right? It can so many variants can make a score different. But if we had some place where we actually had a dashboard where like anything helps, got good fidelity or excellent fidelity, you would know, if you're referring somebody to services when you want to know. So that's
Fidelidometer.
Yeah, Fidelidometer.
The Yelp of fidelity score.
I'd love feedback from you guys about, would that feel okay? Would that be something you'd want to see Washington do? Or is that something that we want to think about when we're, scaling this out? Is that, it might feel uncomfortable for some, but that's just motivation to get
do better.
That's right. So in some ways, it's an accountability piece, but also helps us kind of strive for better, right?
It's an accountability piece that focuses on consumer choice, right? So I get behind that.
That
right?
that in
doesn't matter what I think.
Right. That in of itself is fidelity. Is posting this, where somebody falls is fidelity in itself.
Yeah,
showing
that's
where somebody is in fidelity.
Yeah, it gives them some control over.
Mm-hmm.
Where would I want to get services from? Like, am I gonna? So it's something that I'm throwing out there because it is being done in other places, and it's kind of intrigued me about how you could leverage that as well. So it came up recently, like, how can an agency use their fidelity reports or their scores, or whether they reach good fidelity, to leverage more funding, more opportunity? So that's another piece of this that I want you guys to think about. I see hands up, so I'm going to shut up. But
yeah, I saw Michelle first. We'll do Michelle, and then Dre, you're next.
Go, Dre. Dre, you can go first.
Dre is first.
I love everything you just said, Kimberly. Sure, there's no shock there. I feel like it incentivizes quality services. It incentivizes fidelity-based intentional service provision. And I feel like it almost circumvents the conversation we kind of started this meeting off with, where you can just remove that concept of an audit and just keep doing fidelity reviews, make them required. They should be required. I'm sure once this is an entitlement, that will be the case, hopefully sooner. But that would completely make that conversation null and void at that point. And then nobody gets to be upset about it because the playing field is leveled. Everybody has the same opportunity. Everybody is based off the same scorecard, so to speak. That sounds awful. But it's everybody has the same requirements. It's if anybody was, providers that are upset by it, it's based on your work. So if you're taking it personally, you should.
Sounds like a personal problem. That out.
No, thank you. I appreciate that feedback. That's what we're hoping for, and we are hoping to have it much sooner. This FCS being an entitlement's a ways down the road, so we want Fidelity to be part of this much sooner than we will become an entitlement. That's the end game. It's the long game.
But those are the kind of things that we can learn from other states that maybe, whether it was manufactured by a lawsuit or some other form of accountability, a good idea is a good idea.
That's
So
right.
Kimberly, I caught in the notes that maybe once you have that conversation and get a little insight or kind of get some of that research together, we'll have you come back and tell this group sort of what you were hearing and
Yeah.
whether or not we like some of those ideas to think about for Washington, sort of get people to weigh in, which is really exciting. I love
Yeah.
that. Michelle, I want to make sure we get back to you since you had your hand up. We left you hanging for a minute.
No, you're good. I was just thinking, I heard about, just like we don't want other people's failures to like affect our kind of what we're doing and I think that it's important to remember that we like failures are how we grow, right? Failures give us learned experience, and they give us new direction to go. And that's what we're hopefully empowering the people that we serve with, right? That their failures they don't dictate who they are, right? It just gives us something to grow on. So I think that is part of what we should do with the fidelity. Like, this is not a pass or fail thing, right? Nobody's
Yep.
passing or failing. It doesn't say that you're a bad company. It doesn't say that you're not doing work. You're just maybe need support to do better work, right? Everybody wants to do better work, right? I
Yeah.
hope.
Yeah. That's
And
another
so,
thing. Oh, I'm sorry, Michelle, go ahead.
no, you're good. The other thing is we talked about in the meeting, like, how do we provide a better service to our folks? And we talked about like being trauma informed on the account that somebody may have been working with somebody else for housing, but they don't know who they were, right? And we're not able to access that information. And so just maybe making a more accessible way to figure out, like, if this person is connected with FCS at some point in time, can we reconnect them with their other service provider? And and everybody's like, oh, well, you can call AmeriGroup with the person, but some of the people that we work with, that is not an option for them. They don't want to talk to AmeriGroup. They don't want to call and talk to people. So just making it to where, like, we could maybe reconnect them with their housing provider because they're on a wait list for like a housing voucher or something, right? Maybe it's more beneficial for them to be reconnected with their housing person. We don't know. But if they don't know who it is and we know that they have been, that is just something I think is beneficial for people.
Yeah, sort of an organic way to reconnect back to folks, maybe less formally than the current process. That's a really good point. Mike, I'm going to come to you in just one second. One thing that we missed earlier when we were talking about, so, okay, if we're perceiving this reality where fidelity is going to be mandatory, something we didn't talk about that I think, Michelle, you touched on a little bit is, so what would accountability look like, right? So if we're touting on the one hand, a score is just a number, and really what we want to focus on is high hot, lukewarm, or cold fidelity, or however we want to measure it, right? What would you all perceive as reasonable, sort of like if it's going to be in a contract, like if so it's like if you don't score a certain number, do you lose your contract? If you don't X, Y, and Z, do you have to put a performance improvement plan in place? How would you show actionable things? Does anybody have any thoughts on what accountability might look like around that kind of stuff? So Mike, you had a hand about the last thing, and then I'm sure you
It's
have
it's the same
thoughts.
thing. It's actually the same thing. So
Oh, reading your
so
mind.
it's perfect. So like, the I like the idea of posting the scores somewhere public. Like we already have the provider map, like, right? And like, having that empowers people with voice and choice, and like I think that's really important. But I also think it solves your problem there, right? Because the reality is how many choices do people have in FCS providers right now? How many was it? Like
Oh,
220 or
how
something?
many providers do we have?
Yeah.
Yeah,
Oh, we have
200. Yeah.
300 plus with over 570 sites across the state.
Okay, so they have options, right? And so, there is accountability in posting those scores because you're going to see people choose other options. And while that may not sound fair in terms of continuous improvement, it is because we don't want our clients, attending programs that are improving and aren't at a good baseline right now. So like that will create like the one thing that's been missing out of our service sector has been that client voice driving funding or outcomes for agencies, right? You see that in any other business model. You see that in any other practice. You see the person that you're serving drives the success or the failure of your business, right? You just that's how it works. But here the government decides that, and the providers get to be the voice. And I think that Fidelity kind of creates a voice for clients to choose where they want to go. And so I think that'll just inherently happen. That accountability.
I love that. That's a really good point, Mike, and I grabbed that for sure to sort of think about letting posted scores be a part of that accountability by leveraging sort of consumer choice.
I think one of the things that we've talked about as a team is that, it's not necessarily that we want to pull a contract or make it monetary consequences, right? Because it's really about quality improvement. We just want to see that that's happening. So, one of the thoughts we had, and I put it in the chat, was like having obviously the idea behind a report is that
Was that me?
agency and
Yeah.
them have to work on that plan, and also um, mandatory time with the trainers, because you would be surprised, you guys aren't, because you guys engage with the training team, but there's a lot of agencies out there that don't necessarily engage with the trainers on the level that's why we have them. That's why Anessa and Jackie and Don and Darren all exist, because we wanted to make sure that you guys had all the tools for success. And so mandatory time with the trainers to really understand why we're asking you to do this stuff and how to get there without having to flounder. So those are two things that we've talked about, not necessarily, having to hold someone so accountable, like, well, you guys are just doing terrible services, we're going to pull your contract. And I don't know what it'll look like in the future, but the idea is more to just like keep growing and improving and being able to show that you're at good fidelity. And if you go below 75% of whatever good fidelity is, then maybe that's time that you need to spend more time with the training team, and that there's some, steps for a provider that doesn't reach good fidelity.
So that's a great recommendation, Kimberly. What do you all think when you hear that? Some mandatory training. And Michelle, you've had a hand up for a while as well.
I was just gonna say that's what we do, like for employees, right? We have a a plan to, like, if you are underachieving or if you're not meeting the requirements of your job, right? You do a plan so that you can keep your job.
Mhm.
um, so like it makes sense that obviously I think that that shouldn't happen on like the baseline. Like if you've never been had a fidelity review, then you have a Fidelity review, you get some notification and, you know, of how to maybe better what you're doing. And then, you know, come back next year and see if there has been improvement. And then that is where kind of the rubber meets the road, right? If things are in the same kind of situation, then there needs to be a plan on how things are going to change. Because that's just how the world works, right? You can't just
Yeah.
go through life doing half-ass work and continue to get paid for
Mike,
it, I guess.
You know, Michelle, I think something that really lines up nicely with what you were saying earlier too is that if there was some mandatory training that comes with a performance improvement plan, but we had done a baseline training like you were suggesting, like if you're going to make Fidelity required, then you should make certain trainings required so people know what they don't know. Then maybe that could be a great place to start to include all of that. If I'm just spitballing here, but if we wanted to think about making certain trainings mandatory when someone becomes a provider to contract, then we're holding everyone to the same standard and it's not like not so everyone has access to the same information from the jump and then coming back around in accountability saying, well, you were provided this training and here's how you did or didn't align with it. I think are puzzle pieces around accountability and training that make a lot of sense to me.
One of the things I was just going to respond to Mike's comment in the chat about like HUD funded programs is one of the things you should also know is that Commerce is working towards requiring capital projects and others to they're going to be building out a continuous quality improvement like Fidelity model, and it's actually being discussed at the PSH advisory council that exists. And so just know that there is more lean into Fidelity than there ever has been around not even just FCS program. And we know HARPS does Fidelity, but like PSH buildings having to have some accountability around continuous quality improvement to ensure services. So that's a movement that's happening currently. So just stay tuned because I mean, some really cool stuff is coming down the pike with places and other like, you know, PSH buildings and things that weren't looking at Fidelity in the same way are now, you know, it's going to be part
Thank
of,
God. Thank
yeah,
God.
right. So, I mean, that's really, really exciting. And so just stay tuned. I'll keep everyone posted on what that looks like. And I'm sure Commerce is going to be talking more and more about that down the road, but that's something that is in the works. So,
Ooh, about time.
Okay, I do want to be curious. See your hand up. It is 2:30, so this time I'm actually correct in saying we're at time. So it's okay to hang out for a minute, but also if you need to hop off, I totally get everybody. But Kara, I did see your hand up if you want to sort of share some thoughts on what you were hearing.
Real quick, I have to go, but I need to schedule training with you, Jackie, for some contractors. So, can
Yes.
you reach out to me after?
I think I even emailed you while we were having this
Oh,
discussion.
no way. All right, cool. Thank you. All right, appreciate you
Yeah,
guys.
no problem. Yep,
Take it
talk to you
easy.
soon.
I'm good.
Kira, did you have something
Nope,
you want to jump in with? Sorry
nope,
to.
I'm good. Hi, Kimberly.
Well,
it's
cool.
nice
Well,
to meet
everybody,
everyone.
this was an amazing conversation. I grabbed a bunch of notes. Anessa, anything you need to add or get from folks before we jump off?
No, I just really want to thank everybody for all of the like amazing ideas that we came up with today, all of the participation. Like I said in the beginning, we're going to be having a lot more of these conversations in different meetings and in different capacities over the next 6 months to a year or so. So please stay in the loop, and we would love to hear more from everybody as well.
Oh, hi, little baby. Hi, little baby.
Coda.
I have to hop. Thank you. I know I came in late and just like,
Hi,
you
little
know,
baby.
You're good.
see
All right,
everyone.
everyone. Thanks so much. We'll talk to you soon.
Hey, Jackie, I just have a question for you.
Yeah.
And I need to email Anessa too about something else, but